Dr. Martin, do people still get nose jobs?
So nose jobs, or rhinoplasties, that's the medical word for it, are very common. It's top 5 every year if you look at the American Society of Aesthetic Plastic Surgery's data points. It's obviously more common in women than men. A majority of the patients are younger, 18 and 35, but it definitely, over 35 is definitely common too. And it's very sought after. At least in my practice, we get a lot of consults related to rhinoplasty.
But am I going to look different after a rhinoplasty?
So the hope is that if you go to a very competent surgeon, that you do a rhinoplasty or a nose job, that you look subtly better, and that's the main thing. Remember, if you have a bump you don't like on your nose, we can take that down conservatively. Your tip of your nose is widened or asymmetric. We can make that more symmetric and a little bit more narrow. And that's the key. It's not like the nose jobs of the old days where things look very different. So you take what you have and you just make it subtly better.
How do you know if you should see a plastic surgeon or an ENT, an ear, nose, and throat doctor?
In a majority of cases, the ENT surgeon is primarily the airway doctor. Now, there's a lot of ENT surgeons now that do cosmetic rhinoplasties or nose jobs, but they deal with the airway, and that's specifically the septum, which is the tin pole that holds up the nose, and the turbinates, which are the areas on the nasal airway that humidify the air that goes through your nose. So the ENT surgeon would most likely deal with that. Sometimes plastic surgeons do too, but it's primarily ENT surgeons. And the plastic surgeons deal with the cosmetic part of the nose. That's the outside of the nose, the dorsum, or the bridge of your nose, the tip of the nose, and then also the associated parts with that.
What are the other parts of the nose? I've heard of words like ala. What's an ala?
So an ala, so there's a couple parts of the nose. If you take the nose and you divide it into thirds, you got the upper third, middle third, and lower third. Let's just start with the upper third. That's formed by the bones of the nose, okay? So if that's wide on the upper third of the nose, then you're going to have to break those bones and narrow the nose with surgery. The middle third of the nose is made of cartilage, and along with the lower third. The lower third is where that tip is, the tip of your nose, and it has something called lower lateral cartilages. They form the tip. Also, the lower part of your septum, which is the tint pole or the divider that holds up the nose and divides the airway of your nose between the right and left side. And then you have the ala, and the ala is actually the wings of your nose right here that form the ala, and that's where the air comes through. This ala over here can be widened or misshaped, and you can fix that with a rhinoplasty.